once again have this event. And this event was organized by my wonderful female leaders network colleagues. I'm really proud of it because we have fantastic guest speakers. So welcome to our guest speakers who will be introduced later by Priya. And what are we talking about today? Today the topic is, and it's the third time in a row, it's a topic about healthcare. Why? Because healthcare is one of the sectors which has gone through the biggest transformation over time. And you know that even companies such as Philips, and we have a representative of Philips who is also one of our female leaders, and even Amazon venture into the healthcare sector. Why? Because the healthcare sector is a fantastic opportunity for corporations because of artificial intelligence, tech data, etc. But not only, it's a super opportunity for us humans, for us and for our beloved ones, because thanks to the new innovation, we hopefully live healthily and happily beyond the age of 100. I think for me it might not apply anymore, but it most probably applies. And the big question is only, will this be only for a privileged group of people, or will this apply to all of us? And without further ado, I hand over to Priya. And Priya is one of our female leaders founders. And she is the CEO and founder of a biotech startup, Healiva, which is bringing cutting-edge technology, cell therapy for wound treatment to the world. So, Priya,
thank you. Thank you again for everybody, and thank you so much. And it's great to see many of you today here. And of course, it's my extreme privilege to be here and with extremely, of course, great panelists here. So let me start with Daniela here, and because she and I, of course, both are alumni of the VU, so which we are very proud of. And Daniela have spent almost 15 years in corporate life, mainly into biopharmaceutical sector. And like me, similar story, and that's why I like. She have left the corporate world because of the frustration, because she have went through all the strategy implementation, but of course there was no, you can say, a lack of appetite of the innovation there. And she founded Sarcura in 2019, and Sarcura is working on the cutting edge platform for bringing in cell therapy, but cost effectiveness, same time, of course, personalizing it and safe cell therapies for all the patient. So Daniela, thank you for coming. Thank you being here as well. And of course, we will hear more about different topics in cell therapy. And of course, she will explain you what a cell therapy is as well when we start. Then I would go on my other side. Erich, thank you again for coming here. So Erich is Chief Exploration Officer, SanusX. And again, before founding SanusX, he was working for almost 10 years in executive positions in Unica and as well as Prima Co-Met. And he does hold a wrong degree from a wrong school. So maybe we should have invited you a few years back here and to show you the network here. But he have executive MBA from Insert. And what I really like what you said here, that you strongly believe in international perspective, diversity, and empowerment of freedom and responsibility, which is very, very crucial for, of course, tackling challenges today, tomorrow for healthcare sector and beyond. So I really, of course, thank you again for coming here, and we look forward for hearing from you more. Then I have Darius here from Longevity Center in Poland. We had a bit of a hiccup yesterday, as always it happens. So we were supposed to have Joanna who is the co-founder and the CEO of Longevity Center. But then we saw a message from me and Katrina that she was COVID positive. And Darius was kind enough to arrange the trip within 2 hours to fly in to Vienna. So thank you, Darius, again. And it's our great privilege. Darius is the scientific director of Longevity Center, and he's also specialized in internal medicine and many other different types of immunology, autoimmune. I can go on, but mainly I'm very pleased to to see that of course you're going to talk about a little bit, because you have responsibility in biomarker, diagnostic, and of course mainly into towards the context of longevity. And then you also, of course, looking into, of course, data and how you're using the data to personalize, of course, towards the lifestyle and also the medical recommendation, which is for the healthier longevity and, of course, stay healthier prevention for the everybody. So I'm glad that you are here. You can make it, and you can represent, of course, longevity. So that's.
I hope.
But of course, we will send you, if you want to hear more about Joanna's, of course, what's her mission, we can send you a little bit, a small clip from her afterwards, after the session. Thank you here. So I'll start with Erich from you. So of course, you started with the SanusX, which is the corporate spin-off. So what was your main mission when you started SanusX, or when you, of course, founded SanusX? And what are the hunting area, what you're looking into, the different, you can say the venture areas you're focusing on?
Sure. So SanusX, maybe also to give a little bit of context, is still a 100% subsidiary of Unica. So I'm still with Unica in the group. But what we did in 2019, when we defined a new strategy as an insurance group, we used a structure back then, not so known. I think now it's more in the news and so on, called strange name of ambidexterity. So means in German like Beidhändigkeit. Yeah? So to explore and to exploit. So we said we want to do something different. It was still McKinsey and BCG there, so don't worry. They made a lot of money in the strategy still. But we said we're going to have one part which focuses on our core business, 200 years insurance company, getting better there. Honestly speaking, I'm doing this for the second time, or I did this for the second time back then. A lot of a cost program, yeah, operational excellence. Yeah, you have to do that every 10 years, and we also did that. But we wanted to have a second part where we say, okay, exploration, new customers, new markets, new skills. And for such a strategy process, of course, you do a lot of research, and we looked into different areas, home, mobility, and also healthcare. And when we looked into healthcare and the general trends, I think there are many experts here in the crowd, but just to give you some ideas here, we knew as an insurance company, people are getting older and older. We heard it also in the intro, so that's no news. Our actuaries told us this for years. So I think in 2013, more than 2/3 of the people, 2030, more than 2/3 of the people will be above 60, and many of them above 80. So that's a development which is getting harder and harder. But at the same time, what we saw actually is that people live longer because of the successful healthcare system, but they don't live healthier. So then the years that you live in health are in fact decreasing. Just saw some months, 2 months ago, there was even in Standard an article just for Austria. We looked at it on the OECD level back then, and we thought, like, how is this possible? What's happening there? If you go a step further, it's rather obvious. Yeah, you find one main factor for this, which is chronic diseases like diabetes, cardiovascular, mental illnesses. We also count for chronic diseases. Cancer is also one of them. And then we further looked and said, okay, tough topic. Already back then, 80% of our healthcare costs went into chronic diseases, and it's getting more and more and more. And then we further thought, okay, but actually chronic diseases, many of them are preventable. Change of lifestyle, prevention, all that stuff. So we looked further. Now comes a question for you, and said, okay, 100% of the healthcare costs, OECD average. Back in 2019, we looked into this number. How much is spent on making people healthy who are already sick? So get healthy, as we call it. And how much is spent on prevention? Like, rough guess. So there will be 10% in prevention and 90% in any other guesses? Yeah. Where's the expert? 80-20, yeah. In OECD average is 3% on prevention, 97% on making people. And Austria average is 2% in prevention. We just recently looked into this again, which is crazy if you think about what I just said before. So something needs to happen there. There is a big change going on. I could talk for hours about this, but I will shorten it. Yes, but we found out huge revolution and huge changes in the healthcare system because big challenges, but also some systematic things. So what does this all have to do with Unica? Back then we said, okay, Unica in 2020, the largest health insurance provider in Austria, almost 50% market share. We own the largest private hospital group, is Premica Med, so Privatklinik Döbling, Goldenes Kreuz, Confraternität, and so on, 100% subsidiary. So we are also there very strong. We have a doctors network, we have Vital coaches. So actually, if there's anything in our DNA besides insurance, it's healthcare. So that if we would already be in 2030 and the new strategy would, already be implemented, we look back in 2020 and only a fraction of the things happen in the healthcare industry that we predict. And you look into Austria and say, who should have been part of this change? Societally, also as business-wise, we're also a stock-listed company. It must have been Unica, right? Because we saw it coming, we are everywhere. So that is actually, we have to go into this direction. We don't think insurance is going to die. We still want to stay one of the best and largest insurers in this country and the region. But at the same time, we want to become what we call a holistic healthcare provider. And for this, we founded then SanusX, and as an Explore unit in this ambidexterity framework. And all of a sudden, back then I was head of group finance, and all of a sudden I was the only employee and CEO of this SanusX company, 100% subsidiary. And I had to figure out how I'm going to do that. And now I make it short. We did a lot of research. We hired, I think, a really, really cool team here in Vienna. Not very usual for an Austrian company, I would say. Very international, very diverse. And we had to structure our thoughts, prioritize where do we start, because we want to be relevant all over the life of a person. And we defined for us, based on research and very strict criteria, 4 what we call hunting zones that you mentioned already. We wanted to be, for the beginning, we wanted to be active in mental health. So there we also bought a company called back then Consentive. Now we renamed it Imavi Work. And the second area was primary care. And we actually merged mental health and primary care and made it employee health. Maybe we can touch that a little bit later, why we went into this direction. But that's 2 hunting zones, and the other 2 is a little bit more exotic. Pharmacies. We find pharmacies extremely exciting. 400,000 customer contacts every day. Most trusted player in the healthcare system based on many, many focus groups we did. So a lot of opportunity there. And the last one is more obvious, I would say. It's everything around Pflege, active aging. There we also took 39% in the largest Austrian 24-hour care home care agency. So we are already now the largest provider in this area. And that's also a market, could talk for hours. You can change a lot there and do a lot of good things. That's the 4 areas that we're currently focusing on. That was very long. Sorry for this, but I wanted to give you I told you before, you have to.
So that's actually put us in right spot to Darius for us to, of course, listen a little bit more about what was the motivation behind starting the Longevity Center, and of course going to from the aging and prevention. What are you planning to bring to the world?
You heard from Erich that in Austria you have 2% of prevention only. 2% focused, and you should know that in Europe you have one of the best medical system in the Europe. So if you have 2%, you can imagine in other countries it's worse than in Austria. I work 13 years in transplantological department, so we solid organ transplantation, kidney, liver, and we go deeper and deeper how to prolong the human life, because we can change the liver again, fourth kidney, second liver, and maybe an additional heart transplantation to the same patient. But all of the diseases which make a damage in the organs, almost all are preventable. Really, in our genome we have. It depends what analyzes, but 20 to 30% is in your genome, and the rest of that it's epigenome, epigenetic changes, so methylation of CpG region in your genome, which can switch your metabolism, and you can manage that. So no one analyzed that before. No, of course, longevity sector starts to analyze that and we, even if you discuss about age, in my head, but which age? Because we discuss about biological age, not chronological age, because you count in chronological age in statistics. And as a doctor, I know that I have sometimes patient age 80, which is biologically 60. And sometimes I have a young boy 25 chronologically, but the diseases and the metabolism is like at age 70. So we saw that, and now we can measure that. In longevity, we have biological clocks. We don't have the best one, maybe in Berlin summit in October, Bach Institute, Professor Erich showed the new patented at the day of presentation, new biological clock, methylation. They work 1 year about it. We will introduce it in 3 months probably in the world, but we have other clocks, and we can tell you that your metabolic age is 25. Your chronological age is 40, but your metabolic is 25 or 60. And if it's 25, we can applaud you and good job. You have good genome and you have good behaviors. But if not, then we can tell you how you can change that. So this is the longevity sector. And we created, Joanna, Bensz create the longevity center as a translational medicine. So we want to translate the discoveries from researchers to the practice life in prevention. So we want to fulfill this area, growing from 2% to, I hope, 50% in prevention. And then if you count the money for the treatment of the diseases, of course, it's maybe now it's a little bit expensive because healthcare insurance companies or healthcare systems are not focused on spending money to the prevention. If it's switched, then it will be broadly for usage in all population. Now it's the beginning, so of course it's you need to pay for it. You cannot take money from other sources, but generally it was the motivation to create the longevity. And Joanna, as she tells us, hand-picking of the doctors, and we changed the team. And now I think we're starting to think all in the same direction. We know how to coordinate and fulfill the gap in the healthcare system, we hope.
Thank you. Maybe Daniela, can I go to you next? Because we heard, of course, you were working for corporate world, and of course so many years in all the developing the business, and then you left and started your own company. Please share with us your motivation, and of course, why did you do that? Why you were crazy to start your own company?
Yeah, so I was working more in the 98% you mentioned. So I was working for large corporates, providing mainly manufacturing tools for biopharmaceutical industry. So typical monoclonal antibody, or now everybody knows about vaccine manufacturing. So doesn't work, or I'm too stupid. Better? Yes. Okay. So yes, I made a typical corporate career, created strategies. And at the end, I was in a corporate where I was an innovation director for the pharmaceutical group. And there I dealt with the question, what was disrupt the manufacturing concept as we know today. And there is for a few years now a new therapeutic class, cell therapies, which are mainly used in cancer treatment, where you take immune cells typically out of a patient. You change these cells or manipulate them outside the body, expand them, so make more cells, and bring it back to this very same patient. This created in the first clinical trials 80, even more than 80% of full remission on end-stage cancer patients. So we talk about patients who were sent home to die, a lot of kids on blood cancers, with suddenly they had an option, with a patient material, actually make a drug out of a patient material, which could heal those kids. And so these first drugs were approved. We have today 7 of those drugs on the market globally, 1,400 in clinical development pipeline. But the issue was, and this was my job as in the former position, you can't manufacture that, because you take starting material from an individual patient, and your cells totally different. So you actually make manually to very high costs and little scalability individual drugs, which are super potent, but it's too expensive and actually you can't scale it. So I was dealing with the question how we can industrialize that. So I formed a little team, corporate, they always have money. You may think so. So the idea was we create an own division of that. But then the new CEO came in and said, Daniela, I believe this is going to happen. I even believe in a concept you propose. But come on, this takes another 10 years before it brings us money. And I said, yeah, so that why should I be in that? I mean, my contract is 5 years, And you're sitting there and said, there is one of the biggest disruptions in the last 30 years in this industry, and you were responsible for 20,000 people plus all the patients. Yeah. So yeah, I think you should do something. So we disagreed still. And this was then the point where he also disagreed that I should go on working in the company. So this is why I said, you know what, then I do it on my own if you don't want to do it. And yeah, so it was a kind of frustration, but also seeing an opportunity. Yeah. And I mean, with cell therapy, I 100% agree with you, you should avoid to get cancer. But let's face it, sometimes you will still get it. We get older, we are not necessarily healthy, and there are some influences, environment, out of your control. So you will have cancer treatments and having the opportunity now to use your own cells, to treat you as a patient. Of course, this is super interesting. Yeah, so Sarcura deals with the question, how can we industrialize that? And this is, I don't want to go on technology. It's a very, very technology approach. So we're a classical deep tech company with high technical risk, less market risks. And yeah, we are still early days, but this is what, at the end I was asked, why you do that? I said, honestly, if you come home after a long day and your kids are, why you were not at home? It makes more fun to say, I try to change something rather than, some shareholders I never seen have few cents more on that. And I think I was just last week talking to a headhunter who should fundraise, who should help us finding some people for us. And he said, in my early days, I made headhunting in the IT sector. And he said, they don't care for whom they work and what they do. They just ask how much you pay me. And he said, in healthcare, he never experienced that. People want to do something that is useful. And I think this is also something what motivates you, to create something new. I mean, to even within Unicur, it's, you get up in the morning and you know why you do certain things. You build something because you think, this 2% should come up to 50%. And I think at the end, this was also my motivation to want to do something useful and just disagree with the CEO. So you see, disagree brings you further.
Of course. Now, can I come back to Erich, to you? So, of course, you have both the hat of corporate and startup. What do you think the hurdles will be coming, of course, from the government level, of course, from the startup or from the corporate level, and also individual level? What can we do to change that, the new future of healthcare for all the changes coming? What can we do?
What can we, because you mentioned regulation in the question now.
Of course, because I would like to hear from you perspective. Of course, it's a multiple question. So let's start with corporate and startup.
Yeah.
How they should work together, and then come to the regulators, of course, government level, and then individual level, what should we do?
Yeah, I would just turn around the first two, just to make it, because it was the biggest eye-opener for me. Anyone here from the financial industry, insurance, banking? Okay, one, two. How would you, on a scale from 1 to 10, regulation in the financial industry, how complex is it? 9. Okay, who's here, including you, from the healthcare industry?
Healthcare,
yeah. How would you, from 1 to 10?
10.
Yes, it's... And that was exactly my learning. So I was, exactly. Yeah. So I was working for the Financial Market Authority before I went to work for Unica. So I designed Solvency II, like Basel II, and it's huge regulation. We spent 40 million euros to implement the accounting standards. It's crazy, 40 million euros. The customer has nothing from it. And I said, okay, of course I'm going to go in the healthcare. There's no issue. The regulation cannot surprise me. Yeah, it's not going to be more complex than in financial industry. I know everything. And then you come into this healthcare system where you have 9 in Austria, 9 different social insurance, not 9 anymore, but you have ÖGK, you have S4S, you have Dachverband, where nobody knows what it's actually doing. Yeah? You have the ministry, you have every Bundesland, every state has different, just think about COVID testing. It's crazy. So I think that's one, after 2 years, and I'm really very junior in this area, and I'm listening to everyone and learning every day. I still haven't figured out the healthcare system in Austria. I don't understand it, honestly, even though I'm really spending a lot of time. And that's one of the biggest things, I think, which hinders us to change, because they have so different incentives. Just think about hospitals, and so inpatient and outpatient. So Bundesländer and states, they are No, but the one is financed by the Bundesländer, the states, and the other one is financed by the government. So they are just pushing patients back and forth to get them off their budget. So, but nothing is changing with the overall cost. That's just the easy things that I learned. So like changing the little things, I think would change a lot in the system. But for this, you need time. And what we decided is we're not going to be political. We don't want to be a lobbying institution. So we really focused on the outcome, on the patient and on the customer journey. So everything we do, we go out of the building, we learn. Of course, that limits us to a certain extent. We cannot do the big things. We're not thinking about reimbursement. We are also not thinking about reimbursement from private insurance companies. I'm not getting the money from in Unica, so not linke Tasche, rechte Tasche, but we really, trying to get own revenues. So that's like being patient
Definitely
focused.
need to be changed for cell therapy.
Yeah.
I'm gonna come back to you.
Yeah, but that's the last thing. Yeah, startups, how to work with startups, and that's also learning from me from the last 2 years. And probably if I don't know, Peter Eichler or somebody from the health insurance would sit here with tens of years of experience, he could tell you way more about it. Because you also mentioned the time horizon and so on. I have like literally, I'm not like once a week somebody calls me and tells me, Erich, I have the perfect startup. It's gonna be the billion. It's gonna be the unicorn. You have to invest there. Yeah. And like literally around 20-30% of them really look cool. Yeah, it's like, okay, maybe. Yeah. But then you look at their pitch, how they come to me. Mostly they see me as an insurance company. They are super disappointed. So if you want to come to me and pitch to me, don't expect me to be the payer. I'm not the insurance company. I'm not paying. Yeah, I would send you further on. I'm SanusX. I want to develop own business models. But all of these startups, they come and say, you know what? If you implement my skin screener or my prevention this, prevention that, yeah, whatever it is, cell therapy, your insurance, your policy holders, in 10 years, you will save so many claims, so much money because you will have less people sick. Yeah? Nobody can prove that. Nobody can really measure that in a portfolio of 1 million Austrian insurance people. Plus, and that is an issue. I think it sounds very arrogant, but it's an issue. The time horizon for a stock-listed company, even though it's an insurance company, sometimes it's not 20, 30, 40 years, but sometimes it's 4 or 5 years because also the investors are actually grilling us. I used to go to London, to Paris, to look for funding for Unica as a head of group finance. They are grilling you for the next quarterly results. So if I tell them 5 years from now, the startup brings, that doesn't help. Yeah. So I think if a startup wants to work with an insurance company or wants to change something via the payer of an insurance company, my really strong advice would be show us a real USP, which is not in 10 years you have 10 million, maybe 10 million less of costs, which I cannot even evaluate because there are so many other factors in your portfolio. It sounds a little bit harsh. I know that all of these companies are really, or most of them are really purpose-driven. They really believe in what they have and there is a value in there, but it's just not enough to, in the case of Unica, let them to go to these 1 million people. So like be more, put yourself in the shoes of the payer. And I think then the conversation would be very, very different. Yeah. So this is just for my side on this one.
And maybe I switch to Daniela because, of course, you have maybe a similar. So, what you think it will be most challenging, of course, from the the world of corporate to startup, and what need to change in regulation? Of course, you are in cell therapy, so highly regulated space. But of course, in general public, us like ordinary people, what need to change?
There are parts I agree and disagree with you. So one thing I definitely agree with you is at the end, it's always down to individuals. Yeah. Individuals who see something what others may not see, individuals who dare something what others don't dare. And you have the same then in authorities. Yeah. There are people where is it, yeah, this is something we should really change. So you always need to have this person who supports something. Yeah. So I believe more individuals you find who want the change, is better your chances. Because the one thing I know for sure, there is nothing you can change alone. You will always need stakeholder. Yeah. No matter what you do. Yeah. May this be insurance things or my customers are pharma customers. I'm not so interested about insurance, but nevertheless, you need them. But we have authorities, as you mentioned. Yeah. So we have authorities to on one hand say, okay, we need to make sure that if a drug is applied to a patient, this is safe. You don't want to have a vaccination for your child or for your husband where you don't know if he's going to buy afterwards because, there were some bacteria inside. And yeah, I mean, we tried our best, but we couldn't. So this is not acceptable. Yeah. So this is why the standards are very high, but for a good reason. But on the other hand, it's more you're standardized as little innovation you can do. Yeah. So having from a third perspective, having this ambidexterity again, to say on one hand, you want to have regulations for good reasons, but on the other hand, you know that, hey, there's new therapies out there. There are new, better treatment ways out there. We need to let them come into place. And I think in particular in the biopharmaceutical industry, we have seen that if there is a benefit the authorities can see, better product quality, they're quite open to innovation. Yeah. And when we started that, I mean, we really process cells in silicon. Nobody's doing that yet. Yeah. So we went to customers and said, how you feel? Because at the end, we don't have to go to authorities. You have with your drug and our device. How you feel about that? And the clear answer was, right now, there is no way we manufacture those things. Yeah. So we have highly potent drugs we cannot manufacture. If this solves the issue, I will go through every regulatory issue I have. And I think this is what you were after said.
That's exactly what I'm thinking about.
If there is a
concretely,
benefit and you can show, and in our point of view, I mean, a pharmaceutical drug, it's years of development. Yeah. So I develop right now a device for drugs which are not existing yet. Yeah. So we implement it with other pharmaceutical companies who have clinical trials and not the market product. So the time horizon is very individual for industries, for individuals, yeah. But at the end, I think you really need people who say, I want the change because for whatever reason, I see a benefit in that, yeah. And this benefit could be for society, this benefit could be for my company, this benefit could be of a very individual story. I've met people in this industry where I said, I came to that because I had a relative, who had issues and needed cell therapy. So then I found out about these novel ways to treat. So yes, authorities you need, but I would not say that this is something what avoids every opportunity for innovation, but in some cases it makes it more difficult. But at the end, also there are individuals who are more open to change and some who are less. And this is what you always need. No matter what you do, you need individuals who are willing to do something different. And there's always a risk on that. So,
yeah, maybe Darius, I come back to you to, of course, hear more about, as a doctor, how much impact actually we have from genetic level to, genetic lottery, or what do you think influences most our health? Of course, prevention, we talk about chronic condition, you talked about transplantations. So tell us a reality. What is the biological age, and what do you do in the longevity to?
Yeah, I will answer, but attached to this previous prelegent. We also in longevity centers, we need to explain everyone, also for you, what is it, and if you start to believe that we can measure something, we can use the cell therapy, because as a clinical immunologist and transplantologist, I know the cell therapy. I'm in the group of the chimeric antigen receptor T cells against the cancers, but we switch the target. So we want to clear for example, senescent cells. In your body, you have senescent cells in your immune system, which create a chronic inflammation and create a new bad changes in your body. We can check the amount of senescent cells, and we can use the cell therapy to kill the senescent cells. And we have the companies, startups in the world which are target neutrophils or T cells or NK cells, modified, genomic modified against other target. Because if we are focused on the diseases, so 98% of the medicine in Austria, for example, then you want to cure the cancer, for example. Now, in longevity, we want to use all the techniques, genetic, epigenetic analysis, cell therapy, molecular interventions, and behavior interventions as the main, of course, for changing different place. So we want to remove the risk factors. We want to personalize. So we want to check your genomic predisposition for the diseases, so neoplasmatic diseases, metabolic diseases. We want to check your level, on which level, so your biological age. We want to check on which stage you are and which changes we need to introduce in the exercises, sleeping behavior, cognitive training, all the elements of our health, because our health analysis consists of many things. So microbiome, mitochondrial activity, how many mitochondria in your body are active, how many damaged, what's your body health index, so we can analyze deeply inside the mitochondria. We use the oxygen, you know that you need oxygen for living, but we can check how many oxygen you can use for the creation ATP, also energy for your cells, or you use this oxygen for cyclooxygenases and the creation of inflammation in your body. We can measure that, and we can switch that, and we can improve that. We can give you supplements, mitochondrial supplements. We can show you that you exercise too much and you create the inflammation. We know from 2020, I think, the big cohort of marathon runners, that if you running too much, you have inflammation like chronic COVID or influenza infection. So it's not healthy, and it's not long lifespan. You are high performers. It's not the same like long life with healthy life. So longevity, it's not the performers, it's the long life in healthy condition. So this is our goal. So not the performance. And if you switch the diet behavior, sleeping behavior, movement behavior, all personalized for you, because everyone is different. It's really hard now to create the research when you divide in female and male. We are humans, but 300 genes, we have difference, and 70 genes between females and males are different in immune system. So we need to personalize interventions, and we need to check and then introduce intervention personnel.
Thank you. Maybe Erich, I come back to you about the future trends, because of course, you know, in what you're thinking about, what would be the future trend in the healthcare system, and how the SanusX or Unica will be part of it.
Again, a tricky question. I think there are different answers, but like also connecting to what you just said, maybe three major things that we look at. Yeah, the one thing is the patient-doctor relation. So we think that is fundamentally changing. We're in the middle of that already. So in the past, it's maybe, I don't know, my parents, not so much myself, or when I was a kid, maybe still, yeah. It was like you go to the doctor and tells you something, and you go home and you do what she or he says, more or less, yeah. Today, and the number says 60 to 70%, I think it's way higher in practical, but that's the evidence says 60 to 70% before they go to the doctor, they Google. Yeah? So they say, okay, what could I have? Yeah. And let's be honest, everybody does it. Yeah, before you go there, and then you go to the doctor and you tell the doctor what you have. Yeah? And then he has to argue with you why it might be different. Yeah, why you're not having cancer.
But the secret that doctors also use the Google.
yeah, they want to Google. So okay, that's interesting. Yeah. It doesn't have to be Google. It's getting better. Obviously, like you have symptom checkers and stuff like this. So sometimes it's not that bad. Yeah, it's good information. And it will become more, definitely. Yeah. So the doctor, actually, we think that there's more responsibility in the future shifted from the doctor to the patient. That's an important development. Also connect to the things that I said before, because the system is having issues. And that's one way out, in fact, to that the patient takes more responsibility, but taking over more of this part of getting healthy. And also the tools are getting better. Like I just mentioned symptom checkers, for example. We have great companies, even in Austria, Symptoma and so on, who are doing cool work in this area. So that's a big change. And what you also know from studies, and I think it's well known, the healthiest people in the world are not the richest people, are not the people in certain geographical areas or whatever. It's the people with the highest health literacy. It's that simple. The more you know about your health, the healthier you are. And that's very clear in all the studies and so on that you see. And people will get to know more about their own health. And the doctor becomes more like what we call a coach. So he will come and discuss with you. He will guide you through this information jungle. Less work, but more focus and a completely different task in the future. So that's one of our hypotheses. Supported, of course, and that don't need to talk a lot about this, but digital data, like digital biomarkers, all these Apple Watches and whatever you're using, That's crazy cool because it's like a huge clinical study that we are currently running with the global population. So things we never knew about, for example, the development of chronic diseases, how do they come up and so on. We have now data that we never had in the past, and that will also change a lot, of course. What you also think, and that's more an extension of the hypothesis we built in the last 1.5 years, we also think it's not only shifting to the patient, but you also think that healthcare is shifting also from the private and the public environment into a third pillar, which is the workplace. So we think employee health and workplace health, and I mentioned that we are quite active in this area, and we're trying to build something there which is different from what's currently there, will be a big topic in the future. People asking it, especially young people, ask for these kind of perks, for healthcare perks, for prevention checks, even more a little bit in the area of wellness, which my hypothesis is not really wellness. It has a lot to do with mental health, which is a completely much bigger topic than in the past. And many things will pop up there. And I think the employer will have to take a role there, an important role. And it's also cool for the employer and very a win-win, I would say, because employers currently, like in the war for talent, you all know that, they are looking for people, and it's a great perk that they can use. If you offer healthcare benefits, it's what we see with our like 150 customers, 120,000 people that we are currently serving. It's a big perk that actually has a very good feedback from the employees as well. So that's the one thing from the overall what we think will happen. Second thing, personalization. I totally agree. We also work a lot on this. So personalized medicine is a big thing. Just the question is how it comes and when it comes. We look into very simple, I'm not the scientist here, but very simple 3 areas how to personalize it. One is just simply blood tests. There we experiment a lot because it's the longest history, it's the longest data. Question is just how to take the blood. So we try to do home test kits in this area, just experimenting there. Second thing is, of course, DNA and genetic data. Still too expensive, but we talked about it during lunch today. I think the prices might drop because all the capacities for these PCR tests has to go somewhere. And finally,
Exactly.
these are the same machines. Yeah, so it's fine. And the third one is maybe microbiome. We're also looking into this. Yeah, but also be a nice, smart way to test. But yeah, let's see about this. Third thing I want to make, and then I'm done, is actually something I'm still struggling to understand. But at some point, we probably have to also use more telemedicine, more video consultations, no matter how. But like what we see, and we did really a lot of experiments, not saying it's comprehensive, especially in Austria, the adoption is crazy low. So you don't get the people to use video consultation, for example. And we used it in many different environments on the countryside, in the city. If you look, for example, in Poland, we also do experiments in Poland because Unica is there as well, much higher adoption, much more willingness to use it. But somehow we didn't really find the sweet spot to make the customer use it, but it will have a big role. But the question is when and how, that we could not crack that by now.
Thank you. Maybe, Daniela, I come back to you on the timeline, So, of course, I would love to see cell therapy as a standard of care. Of course, this will be my dream. And that's what we are working towards. What do you think, of course, when you think that cell therapy will come in as a standard of care and, paid by insurances, no question asked. So what's your thoughts on that?
I think a lot in what we see, if we look back how we treated patients the last 20 years, we realized that we make clinical studies, but then at the end we treat like everybody would be the same, but it's not. And I think industry knows that, science knows that. Now, we understand that people would need individual treatments and individual therapies even towards a situation where, a healthcare system can afford that. Yeah, because nobody thinks that 10 people should go together to the doctor and the doctor makes one diagnosis and all 10 people are, running on this diagnosis. But in cancer treatment, we do that. Yeah, it's a breast cancer. You get this drug. Nobody looks at the genetic information of this tumor. They do, but not in a broad way. So I think just being able to have cell therapies, this is already today. Yeah. So in Austria, you can get a CAR T therapy. Yeah, if you are in a certain status. In Germany, in Europe, in US, this is possible. I believe until this is really commercial viable, to a cost price where like a low molecular antibody is handled today, probably takes another 5-10 years because it's a chicken egg thing. Yeah, so you need a lot of drugs there, but then you need also the manufacturing costs to come down in order to allow more drugs to be used. Yeah, and the second thing we see is that people wanna combine the individual information on the tumor, on the patient, with a treatment option. Yeah, so we were just 2 weeks ago in Belgium sitting together with some university hospitals and said, well, at the end, even in cancer treatment, which is, where people look a lot of it, we know sometimes after 2 weeks, just based on certain diagnostic information from the customer, certain markers we're looking for, certain individual aspects, we don't have to wait 6 months if the therapy is over. We know after 2 weeks if this is going to work or not. If you think this further, why should the healthcare system spend money on that if on something you could find out after 2 weeks? Yeah. So I think there is still a lot of education also need to happen. Yeah. That it's not, I made my study, I'm a doctor, this is how I treat patients for 30 years. Yeah. And industry went further and science went further. And I mean, we know so little still about the immune system. Yeah, you mentioned microbial. They say you have a second nervous system, yeah, in your stomach and all of that. This is not known for 50 years. Yeah, so ignoring that and going on like we did is just stupid. Yeah, so I believe it will probably take another 5-10 years before those things are established enough, before you have a next generation of doctors, scientists who just take this as a common knowledge already, which I don't know about you doctors, but I know doctors where you go and and then I sit there and said, I mean, yeah, I hear what you say, but I mean, what about this, and then look at me and said, yeah, where you have that from, yeah. And now we are scientists, yeah, so what if you're not? Yeah? What if you're a banker? Yeah, I mean, where is the discussion you have with a doctor? Knowing, I mean, come on, also doctors like another other profession, yeah, some are good and some are not good. So, and I think also this in Austria, I don't know who mentioned this, I think there's a lot of educational thing that whatever the guys tells you, that this is true. And I think as more options you have, as better educated the people are, as more questions will come, yeah. And I think it's good, not because every individual knows it better, but if you're challenged on something and have to find reasoning, you typically think twice about what you say. And I think together with technical opportunities make our easier diagnosis another 5-10 years. Quick.
Darius, you can add to that because you're the doctor here in the panelists.
I think we in almost all world we have evidence-based medicine in medicine. So we need the clinical studies and because of lawyers. This is the reason. And it comes from United States. If lawyers can block all medicine, then we will wait for the clinical studies and evidence-based medicine. And in longevity, we're trying to find a new technology off-label. So, for example, in the cancers, if you have a standard procedure, evidence-based medicine, and no lawyer have a problem with that, then you can treat by some chemotherapy or radiotherapy. But if you use the new technology, like I don't know, we use the in the United States GRAIL. It's methylation typical for first and second stage of neoplasmatic changes. We have in our center finding by cytometry circulating tumor cells. We have the hotspot mutation in German laboratory. We have prevention panel. It's not the standard procedure, but we searching for all new technology and try to introduce because of actual medical knowledge, not the standard, it's actual. And in transplantology and immunology, we also many times use the drugs off-label, but based on the publications. And one of our goal in Longevity Center is the creation of the Longevity Center Academy to teaching as a teaching center for the doctors and for other clients. If you want to know much more about this wearables, which you should choose, what's the difference between the watches, what's the HRV analysis, for example, in your stress and activation of your sympathetic, parasympathetic, a lot of data. We have a lot of knowledge now. This new, but in all medicine, the lawyers block the invention because you need to be calm at home that your children don't lose the mother or father because you go to the jail. So this is the reason. Evidence-based medicine is the lawyer-forced medicine. and new technologies and new discoveries in smaller part as a primer, and then maybe we hope the knowledge will divide in all population or our society, and then well-educated society will be healthier.
And going back to you, of course, back again, we always hear about longevity, you know, it's for privileged people, not for everybody. So how do you see that in the longevity center? Because I know very well that it's not what you're setting up, it's not just for privileged people. So can you comment on that?
Yeah, we heard that, for example, in United States, some of companies, the health checkup, it's about $40,000-$50,000. And for example, in our center, health checkup, it's 1,500 euros. So it's much cheaper, and it's quite wide, and a wide analysis, and with new technology. All the programs, of course, now if insurance companies and health systems, national health systems, don't refund that, it's also, of course, for someone with money, but not the big money. If you calculate how many money you need to spend on the treatment, if you prevent it, if you feel better, if you ask yourself, you want to go to wellness because you want to feel better, how many you can spend for the much more comfortable car or better bike. And if you try to think, okay, so part of this money I will spend for good analysis and modification of my life, and I don't need wellness so frequent because I feel like in wellness every day. So this is the change of thinking, I think, and this knowledge. So I think this education from us will change for all society. At the beginning, of course, the primers, and if you need to pay for something and you don't have money at all for food, even then you don't go to the doctors and you don't spend 1,500 or 2,000 euros for the health checkup, for sure. But in the near future, I think if we inform everyone what you can know about your biological age, your metabolism, how to prevent all this family history diseases, because almost all of you, I think, in this room remember my grandfather have this disease. I saw the article today about the actor Hemsworth that make a pause in the acting because in the Netflix serial they discovered that has genetic predisposition to Alzheimer's disease and grandfather with Alzheimer's disease, so he make a pause with acting. This all those informations growing up, and I think a lot of you want to check the genetic predispositions, epigenetic changes in your body, and how to improve that. So I hope it will be wider usage, not only for wealthy person.
Now, I'm coming back to you, Erich. Maybe what's your, again, thoughts from the company side? You talked a little bit about, of course, for the, bringing the healthcare to work. So what people in general, the audience should do in terms of, making this happen, in terms of the company should do, of course, make it more happen for the general public or the employees' health. What would be the future of, in the eye of insurance companies? Where do you see the future going towards? So with the trends, which is, you mentioned, of course, quite a lot of different trends, which is amazing, I think. But of course, how the company should take it forward to going towards where you're going for the future trends, and maybe considering employment health, considering, of course, diagnostic, prevention early on. What would your recommendation, of course, suggestions, what you will give to from the perspective of company or insurance company?
I would also separate again insurance company and, so to say, SanusX is kind of a healthcare company, or what we want to become. It has to be humble. We're not yet there, so let's see if we are successful. Especially fascinated by this employee health thought. That's why we're also going so extremely into this area, because even there you have some extent personalized medicine, not for the individual employee, but for the workforce. So what we, for example, see and what we are testing currently, we are developing what we call it super simple, kind of a health analyzer. You let all the employees of a company run through a prevention check, and then you look on the overall number and see, okay, what are the issues in this company, which is super interesting actually, not on the individual level, but on the overall level, that there might be more diabetes cases than in other similar industry companies, or more back pain problems and so on. And you can make immediate changes to the diet in the canteen, or you can immediately make sure, like simple things, yeah. But I think personalizing this is a first step. And then when you know, so to say, what to do as an employer, you can also serve, so to say, your employees and use it in retention and hiring and all that stuff. So that would be for sure super helpful for these companies. And also it will probably help, it was all mentioned now, but it will probably help also financing the prevention topic to a certain extent. So you have, for example, if I'm not mistaken, I think like 4,000 euros per year per person the government is spending on healthcare for an Austrian on average currently, which is, I think, number 2 in the European Union or something. I think number 2. So we're already spending a lot, and we know we have to spend more for prevention. Yeah, so that's not going to work out. Then you have this thing that some people, some very privileged people, can maybe afford to go to your center for 1,500 euro, or also be honest, to go to Privatklinik Döbling, which is on by us for a prevention check for, I don't know, for 800 euros. But that's a handful of people compared to the rest. It's just not affordable. And it won't be affordable for most of the people in the future if you do this really cool prevention check and all that stuff. Of course, you can go to the public prevention check, which is still kind of a mystery for me. I even wrote a paper about this. Yeah, in Austria, it's one of the very rare countries where you can have free prevention check paid by the government. It costs like 100 euros or something per check. It's okay. Doctors tell me it's not good and it's quality, but like I think 3% of the people are using that. Yeah, so it's crazy. Yeah, so also this we could use more, but there needs to be a way out to make it more aware and to bring it. I think bringing it to the workplace is one way out. And you even found a payer with the employer who could actually fill this gap and have a value out of this. So it's kind of a win-win-win. So I think this is a super important one. And then what we also see when we're talking to the employers themselves, and that was very interesting for me, that you could almost make, it's always hard to say that, but almost make a business case out of this. So like we were interviewing many HR responsibles, and one of their main issues is not so much that they, I don't know, lacking offers or that they're not doing things. One of their main issues is actually that they have like 15, 20, 30 different healthcare offerings for the employees. And they tell me, Erich, it's so hard to manage this because there are 15 different suppliers and I don't even know where to go. And then we should communicate with the people. And then you go to the employees and we really ask them, how much do you know about, for example, the mental health offerings that your company has? And like almost no one knows it. The example Unica, vor dem eigenen Hof kehren, so vor der eigenen Tür kehren. So before we started it, yeah, we also had a employee assistance program, the number that you can call when you don't feel well to talk to someone and then get counseling sessions and so on. We're offering this now on our own. And actually Unica was communicating it on the coffee machine. So like it's like a cappuccino 50 cents. If you have an issue, yeah. Of course nobody knew it, yeah. Of course nobody knew where you can call, yeah. It's funny, but at the same time it's super serious because they are paying for it and actually we want them to use it. So it's yeah, so that's one issue for that. That's why we said, okay, let's do it holistic. I don't like that word because it's so fuzzy, but holistic for me just means we offer everything. We do the health check, we do the analysis for the workforce. We tell them, okay, actually what you need is this and this and this. You have some offerings which you don't need, some are cool. We can add this or that offering. And we don't even have to be the one providing it, but I think that would really solve a pain point. That would really solve a problem. And if you can through this hurdle, and I know it's super simple, it's not scientific or something, but then you can manage healthcare much better in the workplace. And then you go a little bit deeper and say, okay, how can we do prevention? Should we, I don't know, do blood tests? We're working, for example, with a really cool startup in Munich, Wallaby, which do like 12 minutes prevention check. And they are, again, not very deep, but for example, you get a blood test within, I think, 14 minutes or so. So they initially designed it for Mercedes-Benz, for the shift workers, to have a really quick check. Now we do it in companies, and then we are offering other things. But you need to start in this way. And I think if you change this environment, that's a big change already. And then if you add things, last sentence, like we're trying to do, not sure if it works, an hypothesis, like we're trying to do in the pharmacies area, for example. Just imagine you could do telemedicine, you could bring the medicine to this health shop that you might have within a company. That's not only very convenient for the employee, but let's think back about chronic disease people who need like a medication, I don't know, every 2 weeks or so. How much time they spend going back and forth to the pharmacy, going there, bringing their prescription, then maybe the drug is not there. They say, okay, I'll come back in 3 hours, all during the work time, of course. Then they go back, then 3 hours later, then the pharmacy is closed. Next day they go again there, and there's so much time. If you could do that on the workplace, you could really save also work time and make it more convenient. So that's a little things, but I think that's why I'm so convinced about workplace and healthcare at the employer, because I really think they can make a difference already there.
Yeah, I can add, because SanusX does have this pharmacy inside, and this is very cool because, of course, you don't have it for chronic conditions or diseases, but general pharmacy. So it's very cool because you can, buy medicines out of a vending machine. So they do have it. So I really liked it when I saw it. And it's
With
a cool
the
idea.
prescription and an e-card. So
Of course, with the prescription, but not for general. I think it's a good concept to start with. And I think what you said, if further on, we can go into a little bit onto prescription drugs as well. Of course, there we need more telemedicine. Before that, probably it will not be possible. Maybe Amazon will do it. Let's see. But of course, what you said, it makes sense. Make life easier for employees, of course, and save a lot of time for employer in the end.
That's the hypothesis. Let's see how it turns out. That's how we have to test it. Many things that we are doing, actually, we are also dropping. Like every 3 months, we think about, okay, what did we learn? And maybe I told you 2, 3, 4 things that we are doing, and maybe in 5 months you come up and say, but you're not doing it anymore. Yeah, because we learned it doesn't work. Yeah, so we also have to be cautious here.
So I will go into the last phase just to have some thoughts. Maybe Daniela, we can go to you. Of course, the audience here, what will be your thought about the healthcare? Of course, what they should do to stay healthier. Of course, not thinking about the cell therapy, but stay healthier. What would be your recommendation in general?
Yeah, for me, it really starts that at the end, your health is your own business. Yeah. And yes, there are doctors, there are institutes, whatever, and you can use them. But at the end, I think the responsibility lies in your own hands. And I think this is something where if people accept that, then I actually disagree with you. If I spend 1,500 euros on a vacation, I can also spend 1,000 euros. So on something else. But if I need to see the benefit, on the other hand, if you don't understand what the benefit would be, if I don't understand what the difference between a simple blood test and a different analysis would be, it's difficult to make this decision. Yeah. So on one hand, I think it's in all hands, but probably majority of the people don't have the deep understanding to really judge that. And I think this is an issue. On one hand, it's your choice, it's your responsibility, but how can you make a choice if something you don't understand? Yeah. And I think this is something we need to solve. Yeah. And yeah, I think it's good if people go in Google and find out, but like with all the other things, it's maybe not the best information they get there. Yeah. So how to change that? I'm the wrong person to ask. But I think this is something. By the way, I also see that as an employer, and I have a small group, but at least 16 people. You have a certain responsibility, and we discussed in the beginning, somebody needs to have a pain point. So I believe as a patient, you always have a pain point as an individual, but honestly, also an employer. Yeah, if I have that many days where people are not available, but I need them, yeah, and I have a young workforce, and 3 of them already had leaves because of back pains, yeah, and I said, we have high adjustable desks. I said, what do we do? Should I come and bring a yoga instructor or what? And at the end, every measure you make, yeah, is a very individual thing. So I don't think that there is the right tool because there's not the right person. Yeah. So we realized certain people like to have that, but certain other people say, oh, forget about that. And we're just 16 people. Yeah, so how you approach it with 3,000? Yeah, you must have a lot of options, and I don't think that for everybody the same measure works. Yeah, so my advice, figure out what works for you. Yeah, nobody can tell you unless you try it. And I mean, we talked in the beginning about COVID, and everybody has seen how kids, teenagers could be influenced by just not having exposure to other kids in their age. Yeah, so I think the mental health topic is a huge one, which 10 years ago nobody talked about. Yeah, and how many we know about colleagues. Yeah. Maybe think, they're strange, and again, they're not here. But how often we really go there and ask it, hey, what's up with you? Yeah, the strange neighbor or whatever. And I think this is something we have in our hands. Yeah, to increase awareness, to make options. You cannot force somebody, not an employee, not a friend, whatever, to make a better options. But I think you can talk about it, and you can make awareness, and you can increase the, talking about this topic, or the frequency talking about this topic. And I think this is what we all could do. Yeah? We will not influence if in 10 years or not we have cell therapies and detailed analysis, but I think those aspects are in our hands. Yeah,
Maybe Darius, what's your view? Of course, what audience our, the leaders here, you can
Yeah,
say what they should do.
I think we agree with this knowledge. We need to transfer our knowledge to our colleagues or society or population, because if you know much more, then you're interested more. You have Google and other way to discover more. I agree with this also, that at workplace or at home, tests are simpler if you're interested, and you can do that. We also focused on that, all these wearables, all this checkup from saliva or dry blood test. We're choosing that because it's easier and simpler. So you need to know about it. You need to be informed. You need to dig in this knowledge, as everyone personally. And we need to offer for all of our clients, because at the finish, in longevity, when I say the patient, Joanna, Bensz, is angry, because we as the doctors use the word patients, and we should name the clients before they became patients, because we want to prevent diseases, not to cure them. But yeah, personalization, knowledge about the longevity and the healthy behaviors, and what we can do at home and measure at home, it's our goal, I think. And we are the advisors. So, as Erich told at the beginning, we are doctors, but we are advisors now, not the guru. We are only advisors, and you do with your life what you want.
Maybe we'll ask the audience if they have any question for us. There were a couple of them, or no? Just one?
One, at least one, yeah. Maybe there come more. Yeah. I can take that one because I think it refers to what I said, and it's a great question. The privacy topic is the first topic we're asking the employees. What are your issues? What are your concerns? The first topic that always comes up is privacy. Actually, are you sharing my health data with my employer? Especially when you talk about mental health. I mean, that's the most biggest stigma and the most fears, of course, as well on this one. I know both sides on this, but in general, that's also a reason why you engage actually a third party to do that, to get rid of this. So you have a company which is specialized in healthcare, and they can talk about mental health mainly, because there we have really a good team, which we didn't set up on our own, but we bought that company, which I think is quality leader in Austria, and they put a lot of effort into separate brands. They show up as back then at Consentive, now at Mavi Work. Yeah, there's absolute Chinese walls, and you have to convince the people by communication, and not only convince them, but prove it that there is no way that the employer gets any individual data. Of course, what they get, but I think that's also should be very transparent, and it's not an issue, is very aggregated data. Just things like how many people overall are calling, for example, that they have an idea compared to other companies, more or less, that they can set measures on a more workforce level to overall do kind of prevention on the workforce level. Yeah? But we also tested the opposite. That's what I say. I know both sides. currently at Unica, we are actually testing, which was not my decision, but we will try it. HR wanted it this way, yeah. So we have this healthcare brand called Mavi, and normally we go into the companies, like I said, 150 employer companies as customers, and we say it's Mavi, and it's not, for example, I don't know, Red Bull or Rewe or something. It's Mavi, and that's healthcare, and it's separated and it's private. At Unica, we do it for our employees, like Mavi by Unica. And I'm really curious what that will do with the people. So we are asking them and testing, yeah, if these flags then even more privacy concerns or more privacy concerns overall, because Unica is your employer and at the same time it's also your healthcare provider. But that's just the one rare case where we have that. Other than that, I think it works quite well also from asking the employees that you can separate this. But still, and that's why it's a great question, it's always the first topic on the list that comes up, privacy and how secure is that.
Any other question from audience? You can just speak up as well if you like. Yeah.
You are talking a lot about like the knowledge, so everyone has to self-educate them. Okay, what can I do? What's out there? How can I improve my longevity, my healthy years I live, right? What do you think, based on your experience? What's if you can give a rough number or a trend, something like that? How many people are actively searching, I don't know, in Austria or in Poland for something like what's out there? What can I do? So what's your feeling? And the second question would be, how do they get this information and where do they get this information?
It depends not the country. It depends how big standard of life you have now. If you have low standard of life, you're thinking about food and water, and you don't discover anything more. If you stabilize your life, you have stable life, and you can see around. You can think about new home, new car, but at some age, you think maybe my health is not so perfect. How can I check that, and how can I improve that? So the age and the standard of life, it's not the high standard, but you need to have fulfillment of the basics and age. And if you have family history of diseases, you try to finding faster. So from my experience, I have young patients at age 20, 18. If someone dies in family because of some disease, I have for all checkup, all body checkup. It's typical behavior if some tragedy is in family appears. So this is the one reason. But if you have stable life and no big medical history in family, then if you have standard life and you have money for interesting of that, then you're starting to think about your health. And then sources is Google, I think, is the main source. And as you know, the sources are created by the special type of persons, so involved in the creation, not the professional ones, involved in creation. So you have a lot of forums. So we as doctors have a lot of, if I have patient don't analyze that I have 20 years of clinical experience, a few specializations, and no, it's one-to-one. I'm an expert and you're an expert, and this is discussion. I have Google and you are a doctor with 20 years experience, it's the same level. If you ask yourself, can you check my knowledge, medical knowledge? If you're not medical doctor, no. So you can think that I'm good doctor or bad doctor if it's your idea. So sources are manageable, but really hard. So we can create a new source of new data, and if you believe us, then you will get this data from us. If you don't believe us, you check that a few times in Google for sure.
Any other question? Oh, we have many now. Okay, maybe how do we increase our personal health literacy? It's similar to what you said just now, so it's very similar. What are the thoughts about the privacy when speaking of more of healthcare offering by the employees? You talked a little bit on that as well already. Which major new breakthrough the health innovation do you expect in next 10 years? I will say it's cell therapy, of course. It has to be cell therapy, but of course you can add more from the doctor perspective. What could be coming in next 10 years? You talked a lot about, of course, different diagnostic personalizing, not personalized cell therapy, personalized therapy, but let's hear from you.
Yes,
first.
I think it's everyone with different experience will answer differently. My experience in transplantology, so creation of the solid organ for transplantation from your cells. So this is like cell therapy. We have few approaches.
Transplantation.
It's like xenogenic transplantation, but now we're creating the new organs from your stem cells and few approaches. So I think in few years it appears. One group in Warsaw is one of the leader with printing of pancreas by 3D printer for transplantation. In cell therapy, in clinical immunology, all your approaches are CAR, NK, or general transplantations and regeneration. So we want to regenerate your organs, your body with cell therapy. We also have the department in longevity with the cell therapy, with a hematologist with experience with transplantation. So we also thinking about that, and we have a contact with the companies which are involved in that. So I think, but if you go to the neurologist for mental health or Alzheimer's disease, also transplantation of the cells, we know now if you open the neurological book and neurologists which you can go to consultation, you ask, did the astrocytes, microglioma in the brain, it's changeable or unchangeable? In the books you have unchangeable. You have brain, stable brain. Now we know it's not true. So discoveries, every month is new discoveries. So 10 years in medicine, it's too long.
Yeah, maybe
everything is possible.
Erich, from your perspective, for 10 years, because I think data, we talked a little bit about, of course, data, about the AI. What do you think? Of course, not picking what you've already spoken about, but I'm going into more AI-based technology. Of course, this is also coming. We know that. Telemedicine you talked about. What's your maybe add to that? What
maybe
else?
one general remark which goes a little bit through all the questions here, at least on the TV. What I don't like to give book recommendations, but one book that I think is very simple and touches the innovation part next 10 years, the health literacy part, as well as the privacy part is the digital pill, the digitale Pille. Some might know that from the digital pill, the digitale Pille, from the former chairman of Roche and Elgar Fleisch, who is a professor at ETH Zurich and HSG. Elgar, I have the luck that he's like a little bit of a mentor to me, and he wrote a really cool book 2-3 years ago about how he sees the future, how different companies are shaping this in a very easy and very good language, I think. And many of these topics are actually touched there. So who really wants to go into this? Just a recommendation on this side. Next 10 years, I mentioned personalization. It's not so much a solution, but like the first thing that always comes to my mind in this area is the biggest issue for me in the next 10 years. And I think that's mental health. So that's something that really, to a certain extent, keeps me awake in the night. Yeah, when I think about what we're currently doing, with, I don't know, the youngest generations, which are not so young anymore, but which like looking into smartphones all day, which we know by now that this is changing something in your brain. But we do it globally, right? It's like a huge experiment with a whole human generation. It's almost crazy. And you also look on some of the things that we already see happening from this, the current, the like ongoing stress, the social media and all this stuff. So I think this is something that we need to tackle urgently. Otherwise, it will somehow tackle us and the whole generation with regards to depression and all the things that we're already seeing. And there are some technologies which really fascinate me. One is, for example, voice. We're not doing a lot with voice. So like, and there are already things and methods where you can, or tools where you can actually, based on voice, predict depression and things like that. So that's super interesting because it's a completely different area than most of the startups are going, which are more like Verhaltenstherapie, so more like very questions and stuff like this, or telemedicine, which is hard. Or we just invested in a Spanish company, also very cool, which working more with chat, with therapeutes, which is also an interesting way. But voice, I think, is something that should be happen much more in this area. And the second thing I say, it's not very popular nowadays because it's super hyped, but I still think that everything around, and I know it's a big term, can kill me now for this, but everything around metaverse and everything about virtual worlds, is something that is super interesting for healthcare, and especially for mental health. I think there might be some applications in there which are way more tangible than most of the things we are talking currently about. And we're also a little bit experimenting with VR, with augmented reality, not only the medical area, there I can see a lot of good use cases, education, learning, all that stuff, but really in the mental health area, I think that's also super interesting.
I have seen actually Alexa for mental health. So that's, I think few months ago, I saw it with the startup which did it, and you can speak about everything. But of course, they are using, again, AI-based technology to train it. And I think that's more and more going towards that as well. That's what I see. So maybe you want
one shot. In holistic approach, of course, is the bad word, holistic, but longevitian way of thinking, chronic inflammation is the main goal, because if you're thinking about mental health, metabolic health, I don't know, cardiovascular health, kidney health, all it's inflammation. Depression is inflammation. Asperger autism is inflammation in your cortex. So you need to try to find why you have inflammation in your body, and this is our goal. When we're reading about and many aspects of medicine, if you don't have focus of infection like abscess or I don't know damaged organ, but then it's mostly from microbiome, gut, etc., allergens, everything. But if you have inflammation in the brain, you have mental illnesses. Of course, if you have genetic also, some genes, yes, but we don't want to separate. I'm trained in normal medicine, traditional medicine, so I know that I'm clinical immunologist, so immune system. If I'm internal medicine, so all the body, but I have systems. All is collected together, and one main thing it's chronic inflammation in our body, also in the brain. Then you have mental illnesses. I think we shouldn't separate our behaviors, and mental health is also attached to all the metabolism in our body.
Thanks for that comment. I need to, because I also felt that what you described for me was more what you see. But I agree with you. What is behind is what people or science just start realizing. What does it mean is how does the immune system actually work? Is a mental disorder actually something with a mental disorder, or is just another information process? And I think, of course, you can separate. I mean, I'm bleeding. So I have to find a patch for that, rather than finding out why this person is bleeding. But I think you cannot disconnect those two aspects. Yes, we need to find a patch for certain things. But in particular, because we know there is a huge population influenced by new habits, by things humans do now, which they didn't do the last 10,000 years, which will cause a lot of issues. We need to understand why and what is the reason for that, not just putting a patch on it. So, and I think this is where a lot of those fields are so interesting right now on the immunology, because the people try to understand and what we learn. I mean, you're the specialist here. What is known now about the immunology system of humans was not known for 15 years ago. And I think we're just at the beginning of understanding how those things work.
It's just one sentence. That's super interesting. And right, good points. I just learned this summer, and this is like there seems to be a gap between people working like neurologists working on the brains and really like what's happening there, like inflammation and all that stuff, and really psychotherapists and then there's like they didn't really talk to each other for the last decades. And there are some recent books that it might be valuable to do that, because you could learn from each other, and that's a big and that's a huge opportunity. I think there you could learn a lot, people from each other, to see it more holistically. But there was it was just a big learning for me during this summer talking.
So additional thing from medicine point of view, which is the same way. If we collect a lot of data from the scientists in many specialization, then we divide in the specialization in medicine. And now we discover that we need to talk to each other. So we have interdisciplinary meetings. So 3 weeks ago, I was on the panel clinical immunologists with psychiatrists about the mental disorders. We created hematologist, dermatologist, and clinical immunologist, and many interdisciplinary discussion. And we discover, oh, it's the same mechanism in your organ and in my organ. So we now creating interdisciplinary in medicine because we need to be specialists because so many data that only specialists can process all of that. And then discussion between the specialization is the beginning process in the medicine. We noticed that because previously dermatologists speak to dermatologists, neurologists to neurologists. Now it's interdisciplinary. So this is changes in medicine.
But I would say that not only just for medicine discussion, of course, the startups, we always say, startup and corporate have to work together as well. So they have to talk to each other as well. Of course, we do it all the time, the startups, of course, all the founders and CEOs, because we love to talk to each other and know more about, and of course, bring in collaboration. But same level, of course, the pharma companies, all the corporates, they have to work together to make it happen for next 10 years. All the new technologies coming in, and of course working together again same time with the regulatory bodies, authorities to make it happen. Of course, going back to the insurance, but we need to work together in generally to make happen all the innovation we talked this panel today. So of course, and I think we have one more question before I end the panel.
So obviously, to have a longer time in life, to a longer healthy time in life, we need to look at this prevention. We also need this treatment of diseases, and there is a lot of changes ongoing now, as we heard here also, and there is a lot of change ongoing, at least in Austria, in the healthcare system as such. And I think there are a lot of, let's say, new offer services, products, but typically they go where the money is, because there are business purposes, of course, earning money. And what I really wonder is, and this is a question to you guys here, is will our kids in 10, 20 years or later still be able to afford health, looking from that perspective?
Oh, that's a tough one, but I think maybe we start with the doctor, and then we can go, of course, to the.
Yes, it's good choice because doctor can work without money. We have in our law in Poland, only doctors can work without salary.
This is one change here. So with the one you get paid from the social insurance and then the private doctors, which is then basically a shift.
Yeah. I think if you will be educated in the longevity, what you can do, what you'd be focused on, then you teach your children, and then they can do many things without the doctors and healthcare system. This is, I think, chance for our children to educate them, because when you observe how the children eat now, the fast food, processed food, inflammation in the guts, microbiome is damaged because of too clear environment, silver everywhere, antibiotics everywhere. So if you inform that it's important that the iron intake now, it's from the red meat is too high. If you compare the grandparents and now, you can eat on the breakfast, lunch, and the dinner too much iron, for example, and we are not prepared for that. So a lot of informations. If you're interested, then you can inform your children, and your children will be healthier generally. So I think this is the cheapest way, independent from the system.
I would add to of course, I think in the future it will be much more easier for younger generation, because we have development like last 20 years, the new developments. So of course, more and more we know quite a lot about healthcare, of course, different prevention methods. We are working on scalability in generally cost effectiveness. So we have new technology, very cost effective. So I would say that even our next generation will have much more advantage than us in terms of getting more innovative technology in much cheaper price, or much, of course, affordable to them. Because right now, when we talk about, of course, example, cell therapy again, we're always talking about, okay, the investors are telling me, of course, oh, but you're talking about millions. And I said, no, actually, thousands of, in few thousands you can treat. But that is not a thought process right now. So I think in future, it will be much easier, I think, for the next generation. And they will be more aware, first of all, I think. And they will have, I believe, of course, we will also have home care, much more home care. Telemedicine, of course, the information we have from the AI based, or the digital apps we have, the collection of information, that will be much more accessible. So maybe we don't even need insurance companies because we have already, maybe, or I'm saying that not exactly, but of course, because we have much more prevention, much more knowledge. So of course, in that sense, of course, we were debating on the lunch today. So do we need to spend like 300 euro a month on a private insurance in future or not? So that will be the question, of course. Erich, you have to answer in
One
next
point,
5
yeah,
years.
like what is insurance for? Like for uncertain future, right? But the more certain the future gets, the less insurance works. The more you know about your health in the future, if you know better that your odds are higher or lower that you get cancer, that might influence your decision to take insurance, which ends up in the insurance portfolio, which is full of ill people and doesn't work anymore. Gesetz der großen Zahl. And doesn't work anymore. Then you don't need insurance anymore and doesn't work. That's fine in the future. That's what we discussed today during lunch. I think I totally, this time I agree. Yeah, so I think this time I agree. So like there will be a technological shift, like always, and things will get cheaper. Like for example, prevention via DNA tests and so on. Just talked about it. More treatments will come up. But I think your question was also in the area of differences between people who can afford a certain treatment and private doctors and so on. Yeah, that's. I think it's also to a certain extent different. What I learned very different from country to country. So just imagine sitting in the US and asking this question versus sitting here in Austria, asking, which is still a topic, and not like, can you go to the private doctor, like to the psychotherapist, for example? Yeah, if you want an appointment in the public system, I don't know, by now 6 months or so, to 3 months waiting time. If I pay privately, 80, 100 euros an hour, I have it tomorrow, the appointment. And that's actually one with the biggest influences. That's a question of how that brings me back to my very first comment. I think this is very much driven by the system. Who is paying for what and why, and who has which incentives? I think there we have to do some tweaks. Overall, I think the healthcare system is getting better and we're learning. So if you're not doing a huge mistake with one of our technological advances, might be the metaverse that brings us into this nightmare, then it should be good actually.
Yeah, just to maybe we have last one before we close the session.
To ask. Okay, so I wanted to ask all of you, because we like in the topic in today's discussion, literacy about your own health come up quite often. So one way, so I know a project which is run by government where they are trying to literate people about doing the normal tests like cholesterol testing, blood sugar testing, and there is a resilience in people. Like, I'm healthy, what you said, why do I have to do all this? They don't want production. This is one thing. Second thing is, like, as I think you mentioned, that a lot of people go on the Google, which gives you a lot of information. This availability of a lot of information can also create a lot of confusion. Yeah, that's third thing which I noticed. The fourth thing is about your company, Longevity Center is offering. Sure, it's offering very cool stuff. I'm thrilled about knowing more about me. But what if I'm diagnosed in the prediction about a cancer which I probably never will have? All of my life I will be living in a fear. How would you deal with these kind of questions, or this kind of a fear creation, or like a psychological handling of it? I mean, sure, you offer a very cool service, but it might create a fear of me having a cancer which I never will have.
Yeah. If you generally have fears, it's manageable. at the beginning, because maybe you don't want to know about anything because work and coming, and you don't want to hear about it. But if you, it's not safer for you if you don't know about your predisposition to the cancer. If you explain in that way, and you don't have a person with increased fear against everything, but if you notice that, then you can consult it and train it. And we cooperate with Mario Martinez, which is psychoimmunologist, or neuroimmunologist, psychoimmunologist. He analyzed the centenarians and how they approach all the life age more than 100 year in all the countries, all the continents, and they go through the First and Second World War and all these bad situations, and it depends how you approach to any problem. Even information that you have BRCA1, BRCA2, and you are Angelina Jolie, and you remove your breast and insert the implants. It's manageable, or you're scary. Oh, I have it, and I don't want to do that. I don't want to listen. It depends how you advise to clients and patients. All the medicine is discovery for us doctors. All of you have some recognition, because if you don't go to the doctors, well, then you feel healthy. If you go to us, we will find something for sure. So it's one way. It's not going to doctor anytime, but it's not our goal. It's inform what is it, how it's manageable, how to prevent it, how to be focused on. If you have predisposition for some, I don't know, colon cancer, then colonoscopy before normal age 40, maybe at 25, for example. This is advisory. So, but if you explain, I think it's not the problem in medicine.
Just on the just ending the, of course, the panel overall nutshell, we heard, of course, I hope it was productive, and lot of information about the future of healthcare. But of course, what we heard is more about the personalized therapies. Of course, we heard about more about the healthcare will be moving into the workplace. We have digital, of course, different tools to use. We also heard more about, of course, privacy, and how next generation will take away all this new innovation. So I think it's for us in the end, it's in our hand, of course, our health, and the prevention, of course, preventing it early on, it's going to be important, because we do not want to, of course, we are coming up with new therapies for the chronic conditions, but we want to prevent it early on. So that will be I agree with we want to stop avoiding aging. So that will be the future of the prevention. But also we do have very innovative technology for chronic conditions as well, to make sure that you live healthier and longer. So I'll maybe end. I have last note from Martina to.
So I don't know how it was for you, but I really, truly enjoyed. And thanks a lot, Priya, for bringing 3 brilliant minds, because this was mind-blowing. And what really got to me was the voice thing. And I hope with my voice now, you don't feel any depression, but you hear the enthusiasm, because this topic really gets into each of us, I think. And whether it's fear or whether it's great interest and thinking about when can we book the next trip to Poland to get our longevity test. So I think we really were inspired. And with this, I want to end and want to really engage all our female leaders to take the survey, because we want to bring more inspiring events to you next year. So please, if you have not answered to our questions in the survey, please do so, because this helps us to continue and live up to our motto, Inspire, Care, Connect. And when it comes to connecting, I invite all of you to our punch. It will be on December 20th. So please join us, let's have fun, and let's continue to connect. Thank you.
I would say thank you again. Thank you again for coming, and thank you again again for staying so long with us and all the discussions about all the future healthcare. And now I think we have some wine to, it's wine and food is also important and good for networking. So I invite you all to join us for some drinks. And of course, if you have any more questions, we are here.